Labor Day weekend is almost upon us. In fact, some of you may have already started your long weekend. But listen to this. Health experts are issuing a dire warning ahead of the holiday. Dr. Anthony Fauci says that the way we behave this weekend will determine how the virus spreads as winter approaches and the months rather get colder. The nation's leading infectious diseases expert is urging Americans to act responsibly to avoid surges like the ones reported after Memorial Day and the 4th of July. His warning also comes as a key model is predicting over 410,000 coronavirus deaths by the start of the new year. That number is mind-blowing. Internal medicine doctor Shoshana Ungerleider is joining us now with a little more insight. Doctor, when I thought about the long weekend that is, right around the corner, it's here now, I thought about The Rock and the video that he just released saying how his entire family got the coronavirus. And he said that he felt that it was probably coming from a family member who had come over to the house, and how we have a tendency to let down our guard with family members because we think, hey, I've been careful, you've been careful, it should be okay. This is a weekend when a lot of people get together with family. What is your biggest concern over the holiday weekend?
Anne Marie, holiday weekends are so tough. We want to get together with family and friends, enjoy each other, and celebrate. I know I do, but I really urge everyone to recognize that we all have the power to allow our children to go to school safely, to get people back to work. Our behavior matters every moment of every day, and the decisions we make matter. I do realize for much of the country, people have been sheltering in place now for 6 months. So the value of social interaction is significant and really impacts our mental well-being. So if folks feel strongly that they need to gather, it should really depend on your individual situation and that of your family, as well as your tolerance for risk, right? Don't forget, just as The Rock said, it takes just one person to spread COVID to many, and that might even be a family member.
And we're talking about, smaller gatherings probably. And I think that people have a sense that if it's only a handful of people that you're interacting with, that it's okay maybe not to wear the mask, or it's okay to sit a little closer. But I think, these are also the types of gatherings that, you sit and you talk and you eat and you laugh and you're there for a very long period of time. And we know now with the virus, there are a few things to consider. It's your proximity, but also the length of time. Are you inside? Are you outside? There are all these sort of things that people need to know or remember that they may forget when they're dealing with a smaller gathering of people.
That's right. Anne-Marie, if people feel strongly about getting together, I recommend holding any gathering outdoors, keeping the group as small as possible, maintaining social distance, wearing masks when you're not eating or drinking. If you have to serve food, know that this is higher risk, and avoiding, putting the food and drinks in one place where guests would have to congregate. That's really important. And I think also having a kind of a tough conversation and asking people ahead of time if they share the same outlook on COVID and take similar precautions as you do. And reminding folks to stay home, of course, if they're sick. I think the bottom line that people need to know is there's no 100% risk-free way to get together with people. And remember that these safeguards become more critical if any guests you're interacting with are high risk, such as people with underlying health conditions or people over 60. The last thing you'd want to do is infect somebody who's at higher risk of serious illness.
Yeah. Now, a lot of colleges and schools have already started up. Some will be starting up after Labor Day, those sort of grade schools and stuff like that in some areas. But we've seen what has happened with colleges. A number of them opened up and were forced to almost immediately go into remote learning because they had spikes. I mean, hundreds of cases popping up in the first week. So in light of this long weekend, you think about college kids, what's your biggest concern?
Well, gosh, if people disregard safety guidelines and we see big spikes in COVID cases after the holiday, this bump can take a few weeks, right? As we saw with Memorial Day and the 4th of July. This is going to have a direct impact on our ability to send children and young people back to school safely and to keep our businesses open. So it really is on all of us to make safe decisions this weekend. It impacts everyone.
Before I let you go, doctor, I want to ask you about something else. Not too long ago, we were covering Russia's announcement that they had a vaccine that they were distributing, despite the fact that the vaccine had not gone through phase 3 trials. They called it Sputnik. And now the medical journal, The Lancet, has released the findings from the early stage trials, stage 1 and stage 2. And they actually look pretty promising that some antibodies were created. But what should we sort of recognize when we're only talking about phase 1 and phase 2, no matter how promising it may seem?
And Marie, so what we have here is that they had two trials involving 76 participants total, which showed, as you said, strong antibody and cell immune response to the vaccine. So this is promising. This is what we consider, as you said, to be early phase study of a vaccine candidate, like the U.S. has done this year already with our vaccine trials. But this doesn't give information about the safety and the long-term effectiveness of the vaccine. You really need to complete large, long-term trials with tens of thousands of people, including a placebo comparison, to know if a vaccine should be deployed to the general public. And that's the concern. By granting approval to use a vaccine before knowing if it's safe is incredibly risky and very dangerous. So just like here in the US, when people's lives are at stake, no amount of political pressure should rush regulatory approval.
Exactly. Dr. Shoshana Ungerleider, thank you so much.
Thank you.